Good morning, and it's wonderful to begin this morning having Harvey questioning our judgment, Harvey, about naming the fund after him. I'm Victor Dzau. I'm a member of the Council and the Executive Committee of the IOM. And I want to say on behalf of the Council, I wish to express our great enthusiasm for the Harvey Feinberg Impact Fund. Now, throughout the years, as you heard from Harvey and others, IOM has made enormous impact on medicine and health, nationally and globally. And this is the nation's most trusted advisor on health and medicine. Indeed, some of its seminal works have transformed the way we care for patients and looking after health. Historically, IOM has independently taken on topics that no one else had thought to ask or simply couldn't provide resources because it was too politically dangerous to support. In the mid-1980s, under Sam Thier's leadership, the IOM provided the first consensus study confronting AIDS on the AIDS epidemic. This report provided a collection of some of the best known practices, research applications, and information on the treatment of this emerging epidemic. And as you know, this report was instrumental in increasing awareness, detection, and treatment of this devastating illness. Some years later, under Ken Shine's leadership, IOM provided its own resources for assessing the quality and safety of healthcare. The two resulting consensus report, To Err is Human and Closing the Quality Chasm, has been very instrumental in raising the profile of healthcare quality and safety as national priorities. And I'm sure you're all aware of the impact these reports have done. Most recently, as you heard from Harvey, it is with independent resources that we're able to convene experts to examine end-of-life care. This committee is looking at the current state of healthcare for people of all ages who are seriously ill and likely approaching death, and who require coordinated, personalized, and communication and support. It is also important to add that this project includes resources for communication strategy to promote public engagement, understanding, and action. With all this yet, I would say it is yet felt by many members of the IOM and others that despite its large volume of excellent work, IOM reports, some of them do not reach the level of visibility or impact that they deserve. To extend the reach of the recommendation and findings of the IOM, we believe that there are several ways in which this can be accomplished. First, of course, is to having the resources to take on complex and controversial topics that we know are important to health, being poised to take on new initiatives that we believe are critically important to address that will allow us to fulfill our responsibilities as the nation's trusted advisor to improve health in this nation. Second, taking on meaningful steps in communication and dissemination in our recommendation and findings. So while resources are needed, we'll be able to, where resources are needed, we'll be able to develop user-friendly messages and materials to target audiences such as government, local communities, and corporations. By partnering with communication experts, we would employ both traditional and social media to share the words of our evidence-based scientific information and have it available, accessible to the public. These communication products may include video, infographics, mobile apps, regional or town hall meetings, public relation designs, and more. And we'll do it sensibly, as Harvey said, but do it in such a way that we're using modern tools to enable us to communicate and disseminate the very important information that we have. We've learned so much from our collaboration with the Robert Wood Johnson Foundation and the IOM consensus report the future of nursing. This particular committee was designed to include a program of dissemination of the recommendations that were prescribed. The resources that RWJ Foundation put toward communication strategy has been so comprehensive and so successful in its efforts that this report has been our most frequently downloaded report of all times. In fact, this report has become the curriculum for many nursing students across the nation. Third, IOM should embark on collaboration partnership with experts who effectively communicate IOM messages to a targeted audience. As we have experienced with roundtables and forums, we have gained a wide array of sectors in healthcare and provide beneficial information on health to many varied groups and individuals. Our work with the entertainment industry giant HBO documentary brought timely and urgent attention to obesity epidemic to the public, not mentioned, of course, an Emmy nomination. By utilizing the most innovative technological approaches to communicate targeted messages to the public, more individuals will experience greater accessibility to our recommendations and findings. One of the most recent topics, for example, we are undertaking involves collaborating with a media organization through Harvey and Judy Salerno's leadership, the public good projects to create a movement that will provide a culture of health, a healthy America. It will use evidence-based storytelling, powerful communication tools, and diverse media platforms to help people of all ages to make informed choices about their health. Finally, we are highly dependent on public government funding, reaching 78% in fiscal 2011. However, first time in the history of IOM, in this current fiscal year, we're receiving less than 60% of our funding from public and government sources. The obvious constraint we're experiencing with sequestration are only amplifying or accelerating the downstream trend in available government resources. We are now looking towards more independent resources that will strengthen our ability to respond, act, to take on problems, seeking solutions, and communicating the results in order to improve the health of the nation. So, the Harvey Feinberg Impact Fund will allow us to achieve these goals and aspirations. Not only is this a wonderful way to honor and acknowledge the vision and goals that exemplify the great leadership that Harvey has provided, it provides also a compass for direction of IOM. It is an opportunity for us to concentrate and focus our research for resources by providing information on the activities we engage in and how our funders can be instrumental in making their impact on improving health and healthcare. Now, the Harvey Feinberg Impact Fund is $10 million over 3 years. I hope all of you are going to give on your way out. We already have received support from the George Family Foundation and members of the Friends of IOM, totaling $1 million to date. Last year, when Dr. Feinberg introduced this concept of Impact Fund to the Council, we collectively agreed to support the goal and proposed the fund in this name and made a commitment to have 100% participation ourselves as providing support for this fund. We have provided more material for you to learn about the Feinberg Impact Fund outside and want to first, however, share with you this video with you so you can hear from Harvey himself why he believes the IOM should be concentrating on the impact of our work and how we can do it and how we can do it in such a way that we can improve the health of the nation. So may I see the video, please?
If it matters to you that children have an opportunity for a healthy life, If it matters to you that people in your family get the quality of health care that they deserve, if it matters to you that America achieves the status of health that our investment gives us an entitlement to, if it matters to you that we have better health, then you should care.
The Feinberg Impact Fund of the Institute of Medicine is dedicated to making a difference in people's lives.
The health needs are vast. Someone could be perfectly justified in saying, why bother trying to make an impact? After all, your job is not to care about what happens in the world. Your job is to create the best answers. I don't believe that. I think the Institute of Medicine has a responsibility from the beginning to the very end. And the very end is not having a high-quality report that sits on a shelf. The very end is better health. Once we get a problem, we know how to mobilize the best of science, the best experts, and come to grips with the problem.
IOM's mission goes beyond responding to complex and controversial health issues. It is committed to asking the hard questions facing our health and healthcare today.
We often don't have the resources to start on problems that need to be worked on, but even more, we don't always do enough to follow through afterward to make sure that the answers are put into practice. We need to do more to encourage action amongst the professionals and leaders in healthcare to solve problems that they can solve. I think we need to do much more to reach out in partnership with others. We're trying to encourage collaboration on a program we call A Healthy America. And the idea of A Healthy America is to use media more strategically, more concertedly, over a longer period of time to bring the messages of health to individuals and families in the communities. And I believe the Institute of Medicine can be an important partner in providing the scientific and evidentiary foundations for those messages that over time will really improve people's health. We do have a responsibility as health professionals to see that the answers we believe are correct are also understood and able to be acted upon. That's what impact means to me. The Institute of Medicine does not currently have sufficient financial resources to be able to carry out this kind of a strategic communication and outreach effort. We should. And I believe with the help of those who care about improving health, we can.
Is that a wonderful film? So as I close, I'd like to read that quote again from Harvey. The Institute has to do more. It needs to be not only a source of advice, but a source of action and solution. Harvey V. Feinberg. So as you can see, we are so enthusiastic about this Impact Fund. And Harvey, thank you for inspiring us. Thank you for leading us all these years. And we believe this Impact Fund will really make the impact that you believe the IOM should have and more. So I'd like to now ask Claire Flanagan, the Director of Development for IOM, who provide you with the answers and how to support this effort. Claire and I have traveled across the country to discover the Feinberg Impact Fund with some of you and have heard much enthusiasm for this work and engaging feedback and many suggestions. We're very much looking forward to working with you, getting your input on this campaign, which we're launching, and welcome your questions at the luncheon today, there will be a luncheon on the Impact Fund and making an impact, and I hope many of you will be there. Thank you very much.